better sleep, sharper focus, a healthier life? It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Hi, everybody. Welcome back. I'm going to tell you about a picture that I found, and a picture that has inspired me to have an entire podcast on it. So a couple weeks ago, our basement flooded. There was torrential rain in Milwaukee, and many people suffered from flooding basements. And while it was annoying and we had a lot of cleanup to do, it also was a great time to purge and get rid of stuff, but also led me to a trip down memory lane. And what I mean by that is I had this old antique trunk full of my journals and my photo albums from early childhood all the way through grad school, and all of the photo albums were completely ruined and saturated and disintegrating, but I was able to peel back the plastic and save a lot of the photos, which I'm very grateful for. So as I was peeling them out or pulling them out, I had to have them laid out across almost all of my house to let them dry out. And so I had no choice but to revisit my childhood and go down memory lane. And I came across, I think, what has to be the most epic childhood photo. It's me with this the most tragic haircut. I mean, my hair was so short, it was like above my ears. I had these thick glasses on, and I'm snuggling this little tiny kitten in this old rocking chair. And the star of the show is that I'm wearing headgear, not reverse pull headgear that we will often prescribe to help grow the jaw forward when the muscles don't work correctly. This was cervical headgear. So it wrapped around my neck, it attached to my molars, and it was designed to hold the maxilla or the mid-face back when there was a big overjet or overbite, I should say. So you would have, I guess overjet is the correct term, when the upper teeth are far in front of the lower teeth. And the idea, when you go granular and you look at what we're trying to fix, if you're only looking at the teeth without consideration for any other part of the system, to get the teeth to fit together, holding the upper jaw back will allow the teeth to kind of fit together like this. But it's missing the point. It's missing dysfunction. It's missing the why behind the growth that's not correct. So it's not that the upper jaw is too far forward. In my situation, the lower jaw was too far back. Okay, so the diagnosis was missed. Anyway, I was prescribed headgear. I was instructed to wear it 14 hours a day, where I had this strap around my neck and then rubber bands that attached to my teeth, and it just pulled back. Looking at that picture, I could viscerally feel the discomfort and how tight it was. And I was an A student. I followed the rules back then. And I found my chart that I tracked my headgear wear, and I would put smiley faces. And then some days I had 16 hours with double smiley faces. Like, I was in it to win it. And I look at that photo and it's heartbreaking. I mean, obviously so embarrassing and cringy to look at just so many pieces of it, but looking at that photo also created a lot of emotion, because while my orthodontist was doing his best to do what he knew at the time to make the teeth fit together, it was the wrong treatment. And that led me to a lot of suffering that I, of course, had no idea about, and actually didn't even know until looking backwards and unraveling everything, that without considering the pieces that are attached to the teeth, if you hold something back, you're going to cause other issues. So if you think about the skeleton and where it is, if the jaw bones are held back, it encroaches on the airway, okay? So my airway was compromised. It was too small, and that led to bad breathing, and that bad breathing led to bad sleep, and bad sleep led to clenching and grinding and anxiety and fatigue, and that was decades decades of this just being my norm. And I ground my teeth down. I remember before getting married asking a friend who is also a dentist to put veneers on my back teeth because I didn't like when I smiled it was really narrow. I didn't like how narrow my smile was. Not from a breathing perspective, but from an aesthetic perspective. I knew that my smile was deficient. But jumping ahead and now looking backwards, what I was noticing aesthetically was a jaw that was in the wrong spot. So when you have an excessive buccal corridor, or when you smile and you see vacant space between the teeth and the cheeks, that's one of two things. It can be both or one or the other. One is that the upper jaw itself can be too narrow, okay? And that can be from a tongue that doesn't rest against the roof of the mouth, doesn't swallow against the roof of the mouth, doesn't promote transverse or width growth, okay? The other part can be if the upper jaw is set back, the widest part of the arch of teeth, is way back rather than forward in the frame of your smile, okay? So it's really common to see somebody that has a maxilla that's back too far to have a narrow smile. And that's what I didn't like aesthetically, and what I was trying to correct with having some restorations put on those teeth before my wedding photos, but I still didn't see the big picture. So looking at that photo is, again, all the feels, all the emotions of going down memory lane, but also really important because I was filled with gratitude, a bit of regret, and like, oh, that poor kid went through a journey that didn't serve her. Holding her jaw back, not understanding that there was a tongue tie, not correcting the muscle function, not promoting both the lower and the upper jaw forward, didn't serve me at all. In fact, it caused all of these things to happen, which was poor sleep, clenching, grinding. And I unwound it as an adult. I went through maxillary expansion. I had my lower teeth uprighted. I had myofunctional therapy in preparation for a tongue tie release. I had nose surgery to clean up my nostrils and my nasal passages. So I went through all of this to undo it so that I could finally breathe better. But it also led to my passion to give patients a different opportunity and a different option. And that's to have providers zoom way out and look at the big picture. Not only how do we get these teeth to fit together in a perfect class 1 molar relationship, but where are the teeth in relation to the jaw bones? Where are the jaw bones in relation to the rest of the facial structure? How are the muscles functioning, and how are the muscles functioning or dysfunctioning in a way that's relating to the development of the face in a child? So I wanted to have the opportunity to have patients have a different trajectory forward rather than just fixing the problem that was immediately in front of the provider that they were in front of. And I think that that's how a lot of medical professionals are trained, is very compartmentalized. You go and see an orthodontist to have your teeth look straight. The end. You go to the dentist to have your tooth fixed. The end. You really need to have the awareness, the providers need to have the awareness to be able to zoom out and look at how the system functions as a whole. And so that was my motivation to start Untethered and create this environment and where we could ask questions of, why is this happening? Why are you clenching? Why are you grinding? Why do you have jaw pain? Why is your sleep crap? Why is your baby struggling to nurse? Why are there speech issues? Trying to pull on the thread to unravel what is happening in front of us is so much more powerful and gives patients the opportunity to be holistically healthy. And I think that that's really, really important. So who knew that I was going to go through a basement cleanup, find this picture, find this gem, and I'll make sure that I include a link to the photo because, gosh, you have to see it. to really have me reflect on not only my own journey and how I wish it could have been done differently from a healthcare perspective and from a suffering perspective, but also how grateful I am that I went through it so that I can now have the passion behind me to create something in which will hopefully help many, many more people. So kind of poetic, kind of emotional, kind of interesting, but I really wanted to share it because it was just too good of a story not to stop and reflect on. Thank you for your time. Thank you for listening, and thank you for joining us on our journey as we try to educate and help patients be their healthiest version by breathing the best that they can.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this, and don't forget to subscribe.
want to learn more about Airway Health or connect with our team?
Please visit our website, untetherediirwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye!